What do you feel is the patient's role in treatment decisions?
From my perspective, the patient's role is very important. I need, as a physician, that the patient feels that is part of the team here. And so when patients come to see me, I strongly encourage patients to bring as many people as they want with them. If they want somebody on FaceTime at the same time, I'm happy with that too. And that helps because the amount of data that we provide, the amount of information that we provide, not only is a lot in terms of quantity, but sometimes it's not easy to understand when you just hear it, one time, right? So having somebody taking notes, having somebody else listening, somebody else asking questions, and then somebody else explaining back to the patient is looking for the best for them. But if he's also, affected by the whole process, I mean, it would be naive to feel that somebody, or to think that somebody was told they have an incurable blood cancer and they are completely paying attention to everything you're saying beyond, after you said something like that. So I think it's important for patients to be there with family, friends, or whoever wants to be there to help out. I think that's a one important aspect. The number two is you need to know about your own disease, and I am fortunate to work with a group of patients who are highly educated to the point that they get to know more about their disease than their own doctor. And I think that's key. I think that's important. For me, that is not threatening or challenging. I think that is actually a good thing. In that way, I can have a more direct, conversation, meaningful, because I understand that the patient is understanding what I'm saying and we are trying to speak the same language. So I think that's key also. So bottom line, I think education from the patient perspective, involvement on their care, I think that's key, so they can be their own best advocates, because there's going to be a lot of, since this is a rare disease, there's going to be a lot of backs and forth with different physicians. Some physicians are going to be, more intensive and more kind of trying to treat when the patient doesn't need to be treated. And I've seen that. The opposite is also true, in which the patients they do need treatment and the physicians are saying, no, we can wait a little bit longer. And again, that has nothing to do with the quality of the doctor. It's just the fact that this disease is rare and to keep up with it is very difficult. Yes. So the patient being their best advocate is actually a very important role that they should play.
Knowledge is power.
You got that right.